Okay, I just got on shift and I just got reports on my patient Joanne Peterson. Her birthday is 12/10/XX. She has no known allergies. She's a high fall risk and a full code. She was admitted to the med-surg unit for a diagnosis of hypertension, and she has a past medical history of asthma. She lives alone and has 2 children that live close to her. Her last vital signs were a heart rate of 86 and a blood pressure of 143/92 with a respiratory rate of 20 and an oxygen level of 98% on room air with a temperature of 37.6 degrees Celsius. She's alert and oriented and resting in bed. She has no chest pain noted. She has the orders of the admission to the med-surg unit with a diagnosis of hypertension. She has a regular diet. She's up with assistance. Her vitals need to be taken every 4 hours. We are to notify her healthcare provider of any acute changes in the labs. CBC, electrolytes, BUN, and creatinine need to be drawn. An IV team is on their way. Her MAR states that she can get metoprolol 50 milligrams by mouth once daily. She was last given it yesterday at 7:30. She has her albuterol inhaler that she can get as needed for shortness of breath, and she can get acetaminophen 500 milligrams orally, 2 tablets every 6 hours for pain as needed. And I am now gonna go check on my patient. Knock, knock, knock. I'm performing hand hygiene and providing privacy. Hi, Joanne. My name is Morgan. I'm going to be your nurse today. Can you please state your name and date of birth for me, please?
Joanne Peterson, 12/10/XX.
Perfect. Thank you very much. So I got on shift and I noticed your your vitals were a little bit high. I'm going to retake them really quick. Is that okay?
Yep.
Okay. I retook your vitals and your blood pressure and your heart rate is still a little bit high. I'm going to check and see if you have any meds for that, okay?
Okay.
Okay, it looks like we can give you metoprolol. Metoprolol is a beta blocker, so it's going to help with your blood pressure and your heart rate. It's going to help decrease each of those, so it's going to help decrease your blood pressure and your heart rate. It may make you a little bit dizzy, so be careful when you're moving around. It may also give you a rash, so if you happen to get that, make sure you call us in and we'll just help you. Do you still want to get that med?
Yes, please.
Okay. I'll be right back. I'm going to head to the med room and get it. I'll be right back.
Alrighty.
Okay. So I'm in the med room. I'm looking at my MAR. And I'm going to get my med ready for my patient. Okay. I have metoprolol, 50 milligrams. It's a tablet. It's not crushed and it's not expired. The package is not opened. It's for Joanne Peterson and it's for her hypertension. I'm going to document after. It was last given to her yesterday at 7:30 and it is due now. I'm now going to do my second med check. I have metoprolol, 50 milligrams, which is to be taken orally, and this is a tablet, so it can be taken orally. It's to be taken once daily. She was given it yesterday at 7:30, so it's due now at 7:30, which it is. I forgot a med cup, so I'm going to go ahead and grab that really quick. And it is for Joanne Peterson for her hypertension. And I'm going to go ahead and document it after I give it to her. Okay, I'm going to go ahead and head back into my patient's room. Knock, knock, knock. I'm performing hand hygiene and providing privacy. Hi, Joanne. I'm back with your med. Can you please tell me your name and date of birth again?
Joanne Peterson, 12/10/XX.
Perfect. Okay. I'm going to go ahead and scan your wristband really quick, okay?
Alrighty.
Okay. So I'm going to do my third med check now. I have metoprolol, 50 milligrams by mouth. It's due at 7:30. It's now 7:30. It's for Joanne Peterson. I have Joanne Peterson here. It's for her hypertension. And I'm going to go ahead and document it after. Okay. I'm going to go ahead and scan my med. All right, Joanne. Here's a sip of water. How did that water go down?
Good.
Okay. All right. Here's your med, and here's another sip of water for your med. All right, I'm gonna document that you took your med now. All right, I'm gonna come back and check on you in about an hour to make sure that the med decreased your heart rate and your blood pressure, okay?
Okay.
All right. It's been about an hour. I'm now gonna go back and check on my patient. Hi, Joanne. Can you state your name and date of birth for me again?
Joanne Peterson, 1210XX.
Okay, perfect. All right, I'm gonna get another set of vitals on you. Is that okay?
Yep.
Okay, I got your vitals again, and they are now looking normal, so your med helped. How are you feeling? Are you feeling dizzy or anything?
Nope, I'm feeling fine.
Okay, did you notice a rash?
Nope.
Okay, perfect. All right, is there anything else I can help you with?
Nope, I don't think so.
Okay, I'm gonna go ahead and lower your bed, okay?
Alrighty.
All right, I'm gonna make sure her bed is in the lowest position. The wheels are locked and she has her call light. Here's your call light, Joanne. The wheels are locked, her bed is in the lowest position. Would you like to lay down?
No thank you.
Okay. Is there anything else I can do for you?
No, I'm all good.
Okay.